All right, welcome everyone. Hello. My name's Kevin Kantz. I am the son of Steve Kantz, who's joining me up here on the panel, along with Chad Riedy. We're really happy to welcome you guys here, and hopefully we can provide some good information and answer some questions for you guys. This is the Advocacy breakout panel. My dad and I both have a lot of experience advocating on behalf of the foundation, which hopefully we can share with you guys. And then, of course, Chad Riedy's the national co-chair for the Advocacy department, which means that he is far and away more knowledgeable about this stuff than we are, and we're really excited to have him join us today. He's actually going to kick us off with the panel. So we're going to get started right now with Chad Riedy introducing us and going through a couple of slides here. So thank you guys for being here.
And one thing, Chad, before you get going, questions and Q&A, that's the whole point of this thing. So just interrupt us. There's a mic going around. I think Sydney has a mic, right? So if you have a question, definitely speak into the mic so Chad can hear it. But thanks, guys. All right, Chad, all you, Chad.
Perfect. All right. Thanks, guys. Thanks for being here and welcome to encouraging advocacy in your community. Let's go ahead and change the slide if we can. So as we said, my name is Chad Riedy. I am coming to you from Alexandria, Virginia. And I say hi to my wife, and my parents are in the audience also there. But along with Steve and Kevin, we are going to sort of run through a couple of things dealing with advocacy and the importance of advocacy to the foundation's mission, and then ways you can get involved, and how you can recruit others to get into our cause. So before we get going, I just want to take a couple of minutes to talk about the importance of advocacy to the mission. So if we can, there it is, perfect. Somebody's reading my mind over there. So quickly, I'll just read the mission of the Cystic Fibrosis Foundation is to cure cystic fibrosis and to provide all people with the disease the opportunity to lead full, productive lives by funding research and drug development, promoting individualized treatment, and this is the key thing for this group, ensuring access to high-quality specialized care. Advocacy is vital to the mission of the foundation. Because we have taken incredible strides in the past 10 years of advancements in not only care for those of us living with CF and your loved ones, as well as drug development. And what good are those drugs and that specialized care if we can't access to it? And so advocacy is part of that, and making sure that we have access to adequate and affordable coverage is sort of the key driver to this. But advocacy doesn't just happen at March on the Hill and Teen Advocacy Day. It's much more than that. It's not one day, it's year round. It's meeting with congressmen, it's meeting with senators, both federally and at your state and local levels. But it's also just sharing your story. It's also talking to anybody who will listen about CF and how it affects your loved one or yourself, and spreading that awareness, because the more people we talk to who know this about CF, the greater impact we can have, and encouraging them all to get involved as well. So before I turn it over to Kevin and Steve, and Steve will start us off, I just want to have you guys think about one thing as you go through this and you listen to everything. Advocacy does not have to be difficult. It's easy and it's not scary. I remember the first time I went and sat in a congressman's office, I was mortified. Here I am talking to this congressman and he wants to hear my story. But I got a piece of advice that I will pass along to you all, that you can pass along to the people that you recruit. You and your family are the experts of your story. Nobody can tell it better. And everybody will listen to your story. They can't question you on whether or not you know what you're talking about, because you do. So share that story with everyone that you possibly can. And together we will continue to make an impact and make sure that all of us and those we love with CF can continue to take advantage of that specialized care and the access to those life-changing drugs that are coming down the pipeline very shortly. So with that, I will turn it over to Steve And I look forward to taking any questions that you guys have throughout.
Awesome. Thanks so much. And we won't do it now, but huge round of applause to you. He's been amazing. And you guys, I think we missed it because we were in this room, but I guess Jeremy did just an unbelievable job of describing it. So I got to see the video. I understand there's a video. So, and there's amazing people in the room here today. So get a chance. A lot of folks have actually been so successful, they have their talk track down. They know what it's like. And what you just said, Chad's so true. It's not scary at all. It's actually fun. I was just in, we're the 18th district in California, so we're in Northern California, kind of Palo Alto, parts of San Jose. And Anna Eshu, we've been seeing her since he was 13. And so, we know them pretty well, but I was just in their offices on Wednesday. And it's a quick 15, 20 minutes updates, and it's with the deputy director and Ann Ream, and we've kind of built this bond with them in terms of updating them on what's going on with the foundation and what's going on with Owen, who is his little brother, and that's our story today. We have 3 boys, and the youngest has cystic fibrosis, and he's 16 years old. He's at home right now going to baseball practice. He's doing pretty well because of all the work that's been done by you guys, so thanks again. So let me get through a couple slides, but if there's questions, ask them away. We probably won't answer them. We'll make Chad answer them, but so in 2018, advocates attended 2 federal advocacy days and 9 state advocacy days. They sent nearly 33,000 online messages to their elected officials. At March on the Hill this month, and that was just now, 150 advocates met with 315 congressional offices, and nearly 2,000 advocates supported them from home by sending over 5,000 messages to Congress as part of the online Day of Action, which is amazing. We often hear when we're on the Hill, especially with Teen Advocacy Day, how we stand out as an organization on the Hill for these kind of events. Not just the fact that there's gobs of people there and gobs of messaging, but the way we message and what our content is and how we do it. And that's so thanks to the Cystic Fibrosis Foundation, the staff. They're amazing. They prep us so well, and we're on point. And then I'm going to come back to that later, because when you do go meet with your local representatives, it's a really important thing to just be really concise and crisp and have that legislative agenda in front of you, because they want to know what it is, because they're just, their days are, every 10 minutes something new is hitting them, right? So last bullet here, and this is for Chad. He just testified before the House of Representatives Committee on the threats faced by workers with pre-existing conditions, and it's just an amazing job. And so I just want a quick round of applause for Chad, because that was awesome. And you get to hear from him. It means so much more when you're listening to not just your constituents, but the people like Chad that are out there telling their stories. So we kind of got this already. This has sort of been beaten down. Drew talked about it in the last session, but if you do text FIGHT-CF, and that's one word, you will get a text back that's got a URL, and just click on that, and then you sign up. So it's a sort of a 2-step process, but it's really easy, and then you're there. You're done. And you're going to start getting texts and emails either weekly or daily, whatever you sign up for. It's pretty easy. But that allows you to start sharing your story. You can still make that call locally, and you should. Please do that. If you have, how many people actually talk to their congresswoman or congressman in their local district? Yeah, about half. That's great. We try and do it a couple times a year, twice a year, and I'm not sure. Is that my next slide? No. So let me just. Actually, it is the next slide. So the importance of the in-district advocacy. Anna Eshu, I think it was 2 years ago, Mary, one of the CF staff, they would know, but she, on the floor, cited a story during the healthcare debates about a cystic fibrosis patient. And she brought that to light because it was one of her constituents in Palo Alto, and it resonated. And that's one of the reasons why we're so close with her, is because she knows our family. She hugs Kevin. But we're in there twice a year, and usually in Palo Alto, and then we visit either March on the Hill when we're there, advocating with the teams, or if we're at Teen. And my kids are aging; they have aged out. I feel old, but I don't know how many we've done, 12 or so. But Ryan is his little brother, and we went to about 11 straight, and so we saw Anna every year in DC and also in Palo Alto. The power of it, though. It's not going to be a 40-minute meeting typically. Sometimes they are with Anna, but you really have to have your 1-minute message, your elevator pitch, 20 floors or whatever that is, your 5-minute message, and about your 15-minute message, which is about your personal story. If you can get those down, you can talk to anybody at any time and be confident because they want to hear. One thing you're going to have, like California, we have a lot of, there's 435 districts, there's 435, representatives. There's a lot of congresswomen and congressmen out there, so make sure you can talk to anyone that's in your state or not in your state, but definitely get to your congressperson that you're a constituent of, because that's a much more powerful story. Plus, they care because guess what they want? They want your vote, right? So that helps a lot. But 60%, I want to just read a couple of these bullets here, say constituent meetings in the district are the best way to build relationships. And I'm a true believer because we do that, twice a year, as I said. Most members of Congress are home 40 weekends a year. So obviously they're traveling back and forth, and in California, Anna, it's probably even less because she probably stays over a little bit. So getting her in person is very tough, but if you get that next person in line, and this the district director, in our case in 18th Congressional District, it's Ann Ream, and she's Anna's face. So every meeting they have, and this is true across every single office, they have to put a summary report into the congressperson. So no matter what it is, it's got to be a summary report in. So your voice is traveling. And it's okay to be persistent, for sure. They want to hear from you, and they're tough to get a hold of. We're all busy with our lives without a doubt, but I think our lawmakers, it's literally every minute. In fact, when the Mueller report came out, right, Anna was busy writing her response to that over the weekend. So they get pulled, and all of a sudden it's a Saturday afternoon, and some news breaks, and they've got to go respond to that. So there's also the ability to sign up through www.govtrack.us. And if you don't know, which I'm sure you all do, who your members of Congress are, your senators and your representative, it'll instantly pop up when you populate your address in there. And then it'll ask you, do you want to track them? And are you following them? And then from that point on, you'll be getting legislative updates. And what's cool is when you click on, like Dianne Feinstein, GovTrack actually gives you this whole report card about where she sits politically, what legislature has she brought for votes, what has she voted on, how has she voted, what's her record been. So it's a really neat site. And if you just take a chance to go take a look at it, because you'll learn a heck of a lot just with one seating. So I highly recommend doing that, and then you'll get data pushed to you. Let's see, I think senators, yeah, I went through all that. So we're going to have a quick discussion, but is anybody in the room from Maine or Montana or Arkansas? Anybody? Arkansas? So I think, I could be wrong about this, smart people in the room, but of the states, I think the only 3 we have both senators on the caucus are in those 3 states. So thank you, that's awesome. There are, I don't know how many caucuses there are, but every day your representatives get asked to be a member of that caucus, so it means a lot because they want to put time in. We have, I want to say, 40 states represented, so we need to get the last 10 for sure. And I'm not sure how many people are on the Cystic Fibrosis Caucus. I think it's in the 130 range, but more is better. We have some great leaders, the chair, Markey, and the rest of the guys. Get to know them. You can send them notes as well. But if you haven't engaged, quick discussion here. Any questions first? I'll pause for a second.
Could you put that slide that was on right before that one?
This right there? Yeah, absolutely. Perfect. So we will take questions after, so I'm going to hand it over to Kevin.
Well, okay, also, the online portal we used in the last room to submit questions, that's also active for this session as well. I have the iPad up here, so if you go to that same website, instead of clicking on, I think it was called the welcome session from before, you can just click on the advocacy breakout panel and then submit your questions on there, and those will get passed along to us as well. So you can submit them through that, or like we said, there is a mic we have in the background that can be passed around. So if you guys have questions that we might not be able to get to right now in the middle of the presentation, feel free to submit them online, and we'll get to them at the end when we go to the Q&A session as well. So keep that in mind. There's multiple ways to get your questions asked.
And then last thing, sort of a challenge. I think if you guys, in the next couple of months, send an email to your local representative and get a meeting. You'll probably end up with a staffer, and it could be a healthcare staffer, it could be the deputy director. But when you go in, either send the foundation note, send Mary a note, send someone a note in there that says, hey, what's the key legislature that's on the on the floor right now, or what's being proposed. have that at your ready and make sure you're aware of it, just what it is, ask for that vote. They're really big, particularly in California, right, in supporting the NIH and the FDA, but just have a short agenda and try and have about 10 or 12 minutes and then let them ask you questions. If you can do a 10 or 12 minute meeting, they'll appreciate you because one, you've got a great message, you're a constituent, they want to hear from you, but it's short and to the point, and then they'll want to see you, every time you ask for a meeting because they know you're not, it's not like a bad thing to be there for half an hour, it's a great thing. I mean, show pictures, but if you can really, really be on point with, hey, this is why I'm here, this is our goal, this is what the Cystic Fibrosis Foundation is all about, they'll really appreciate it. So my task to you guys is, when we come back, please go have that meeting. At the very least, you'll get an introduction and they'll know who you are. So with that, Kevin, take it away.
Hello, everyone. Again, my name's Kevin Kantz. I'm the proud son of Steve and Catherine, who's sitting up here in the front, supporting me, taking a couple too many pictures. But we'll move on. So I am 21 years old, so I'm a little bit younger than some of the people in the room, but I think that I bring a fresh perspective. I've managed to attend a lot of different Advocacy Day events, and I think that's kind of one of the things that I'd like to pass along to you guys. If any of you guys have children that are interested in attending Teen Advocacy Day or have not yet, I think you guys should really think about that. For those of you that don't know, it's anyone, I believe, age 12 to 18. They spend basically a weekend in June when everyone's on vacation from school. You get an all-day training on Wednesday, and then you spend an entire day Thursday in anywhere from like 5 to 8 meetings with congressional offices. I was lucky enough, my parents got me involved in it, I think in the second ever year they did it when I was 13 years old. And I participated every year until I was 18. And so that was 6 consecutive years, like my dad was saying, where I was getting FaceTime with either a congressional representative or their direct chief of staff or their healthcare chief of staff. And it made me feel like I was doing something at such a young age, which not a lot of kids for a lot of foundations get to do. And that kind of purpose for the CF Foundation was really formative to me, and it's part of the reason that I still try to stay so active. So I really encourage you guys, if you have any questions about that, if you have children that are of that age range, really try to get involved because it's a lot of fun for, I think, the parents and the kids in general. So that's my little pitch for Zoe in the back who helps run that event. So the second step, now that my dad's talked about kind of the importance of Advocacy Day, is what can you guys do to recruit others to join you? Recruiting people is actually really easy if you think of it like Great Strides. I don't know how many of you guys have ever attended the Great Strides. I'm assuming it's everyone in the room. How easy has it been to get people to come to Great Strides with you? I know some of my memories of when I was really, really little, we had Team O and we went to Great Strides and there were 50, 60, 70, I don't even 100 of my parents' friends and their families that were all coming out just to support my little brother. The Cystic Fibrosis Foundation is such an easy cause to get behind. We have such a powerful story. We're so successful at that getting people to join you in your cause is super easy. All it takes is a little bit of proactivity, a little bit of ambition to kind of reach out and say, will you guys help me fight this cause? With that, though, we kind of want to temper expectations at times because there's not always a fire, which is what Zoe, how she explained to me before. There's not always pressing healthcare needs that need to be fought and discussed like there are even right now, for example. We had Teen Advocacy Days, I think the second one we were there, I don't remember the exact timing, we were on Capitol Hill the day that the Affordable Care Act was signed into law by President Obama. That was a crazy day. From a legislative standpoint for us to be there. We were also on the Hill the next year when things had been kind of running really well for the CF Foundation. There was no pressing legislation that we had to fight and say, we need a yes vote here, or we need you to strike this down. It was a thank you guys so much. Your support is so appreciated. But even just that FaceTime and that gratitude we were able to express to them was so helpful that then when we came back 3 years later and there are pressing healthcare needs, they remembered us not just from when we needed a vote, but from when we came in and said, hey, we really appreciate you guys. Thank you so much for all the work that you've done. And that's a lot more powerful than you guys realize. So even though there's not always a fire to put out and there's not always legislation that we need voted on and we need a specific vote, there is no reason not to stay active and stay engaged, because if they remember you when times are, for lack of a better phrase, thick and thin, it means a lot to them. And it's going to go a lot longer in terms of having a face put to a name and just kind of getting your ideas in their head. So I can't encourage you guys enough to, even when there's no immediate action, keep your members updated. Go meet with them, talk to them, send them updates on how your loved ones that have CF are doing. It's really, really important. And ways you can stay engaged, you can read emails, participate in webinars, and you can share that information with others. And this also goes for your friends as well. Your friends and family and loved ones and people that support you and go to Great Strides, you don't only have to lean on them when times are tough and you need them to send emails to congressional representatives. You can lean on them when times are going great and just say, hey, we'd really appreciate a reminder or an email to your congressional representative, and just let them know how things are going. Because again, the wider a net we can cast, the better. And then again, leverage the power of your personal story. I've already talked about how easy it is to get people behind this cause. It really is. But engage your circle, and keep in mind that Great Strides, and in Northern California we have the Breath of Life Gala, which my parents have always had their friends at. They're incredible events that we put on, and the cycle hike, or the cycles, the extreme hikes, all these events that we do that are fundraising in nature, and they're meant to raise money for the foundation. They're incredibly important, but fundraising is not the only place that we can ask for help. You don't always have to reach out to your friends and loved ones and say, can you help donate money to the foundation? Just a quick list of things, kind of going from easiest to hardest, that you can ask people to do that don't actually involve any donation. Can you sign up for advocacy alerts? That doesn't just include people in this room that are involved in CF. Anyone can sign up for those and learn about when advocacy is needed. Will you send an email to your elected officials, particularly if you have friends in different congressional districts? I know we kind of live on a border. There's some of our friends that we're really close with that are actually in Zoe Lofgren's district instead of Anna Eshu's, and it's really easy for us to say, how can we get our immediate circle of friends and all of a sudden reach out to 2 congressional representatives? That's just doubling our impact. Can you ask others? Can you ask your friends that you know and trust to ask their friends that they know and trust to help via social media or email? Can you just keep casting that net wider and wider? Will you call your elected officials? Will you go to a town hall or an in-district meeting? All of these are ways you guys can get people involved and get them to assist us in this fight without asking them for money, because I know it can be tiresome and it can almost be uncomfortable, especially me coming from a point where I'm not as financially stable and my friends don't exactly have houses to lean on. So there's ways you can get people involved, and this is just a short list of things that you can do. So don't think that everything is money-centric. Keep in mind that you can always ask for people's help and their support through a variety of avenues. And so again, who are some people that you can ask? Family, people who have been on your Great Strides team, also neighboring teams. I mean, everyone in here, it's incredible that you guys have come out to this event, and some of you have flown from all over the country, and you guys are the most dedicated and the most active CF families and CF advocates for that, for a better word. But not everyone that I'm sure you've seen at the Great Strides event, or not every team that's been at all these walks and these hikes, I bet they're not all represented here. And it's really easy to think of the immediate people who have direct connections to CF but might not come to these events, or might not go to March on the Hill, or might not go to Teen Advocacy Day. They'd be interested in a second to do this kind of thing. And so reaching out, that's just such an easy place to start. All the other people that have direct CF connections that may not be as proactive about it, why not start there? Talk to your coworkers, talk to faith groups, talk to people and businesses who donate and support you and your work to support people with CF. The list just is almost unending in terms of people you can reach out to and you can engage. And so what I think we're going to do now is we're going to do a quick little challenge and a break, and also gives you guys time to answer some questions. But amongst yourselves at your table, try and list at least 5 people who you haven't already that you can ask to engage on advocacy. Even if it's a simple text that says, hey, I'm at the leadership conference for cystic fibrosis. Would you be willing to sign up for advocacy alerts and learn about when we have important issues that we'd love your support on? I'm sure that everyone in this room can come up with 5 people that don't already sign up for advocacy alerts that you can ask to sign up. So right now, take a couple minutes, think about it to yourselves, talk to the people at your table, write down those things, and then I also want you guys to come up with the next 2 things you're going to do when you get home to maximize your at-home advocacy. And this could be things that I've talked about or my dad's talked about in terms of getting a meeting or sending an email or calling a representative, particularly now where, again, it is a little bit more of a pressing time from a healthcare perspective. It's really important that we do this right now. So get together, think about this to yourself, and also feel free to submit some questions, because after this we're going to kind of go into the Q&A session. So yes, have at it, and we'll reconvene in about 5 minutes. All right, I think we're going to come back together now, guys. Sounds like you guys had a lot of really good discussions. I encourage you guys to keep having those discussions over the course of this event and going forward. Really quickly, just following up on this little exercise we did, raise your hand if you came up with 5 people that you could send an advocacy alert to, and you wrote them down somewhere and you have a note. Everyone's hand should go up. This was the only homework you had. Did anyone already send a text asking someone to? We got one person. That's a huge round of applause. Great job. Everyone should follow that person's lead. All these people, I'm sure, would love to hear from you guys, hear about how this convention's going, and I'm sure they wouldn't be opposed to you asking them to sign up for advocacy alerts. So great job over here, and everyone, hopefully, if I ask that question in 30 minutes, everyone might be able to raise their hands. That's it for my section. I'm going to kick it back over to my dad for a couple seconds, and then Chad's going to close us out in a few.
Okay, so first I'm going to tell a quick story. So, but there are a few questions coming in from the people that are. What's that? I gotta read it. I don't know. Oh, okay, we're not doing that yet. Stupid kid. Just a quick story. So I think it was the second year that we were doing Teen Advocacy Day, and we were in a Republican California congressman's office. And I don't know if you guys remember, but the first 40 minutes after the Supreme Court voted on the Affordable Health Care Act, they got it wrong. CNN and all the news agencies reported it as the reverse. That Chief Justice Roberts had actually voted the other way. And so we're in the office, and we were trying to meet with the Republican congressman, and he supposedly wasn't there, and then all of a sudden he comes out of his office. He's all excited because it was struck down. And we were just like, oh my gosh. And that was what Kevin was talking about, right? We've been so lucky to be on the Hill when these amazing things happen. But we were deflated. And we were absolutely just like, my gosh, this is the whole reason we're here. And our shoulders shrunk, and we were like, what do we do? 20 minutes later, we're in another California congresswoman's office. And all the news is like, wait a minute, we got it wrong. It actually passed. And we're like, I wanted to go back down to the guy's office and say, hey! So I just sent him hate mail and stuff. But no, I mean, doesn't matter what side of the aisle on. I mean, we've got a lot of great support. So I did want to. I think there's a couple questions that came in. Are we doing that now or no? I think no. So one thing about this. So I'll let you do that. So if you guys did this, if you guys said you will. What's kind of cool is automatically when you sign in, there's already an email waiting for you to go to your. Have you guys done this? Yeah, it's cool. So I think it's actually saying, hey, will you please join the caucus for cystic fibrosis? So when you actually sign up, there's an automated thing. Just, hey, we're going to send an email on your behalf, and it goes out. So if you did it today, then your senators and your congressperson got a note asking on behalf of you to join the caucus. So it's really cool, and that's the kind of thing you expect. So there's community webinars as well. So every 6 weeks or so, there's policy updates. So you're going to get those for sure. And then you're going to get, the page, I just pulled it up. I forgot how great it was. But if you just go cystic fibrosis advocacy and just Google that, or just go to cff.org. But the advocacy page is unbelievable. It's got everything that's important, all the legislature that's in play right now, the current advocacy actions, healthcare reform, so you could actually just use this page, spend 20 minutes on it, and then go do your meeting. So there's a question I think that's in there about, how can the foundation help? This is how they help, or you can send them an email, or you can call the office, and they'll prep you with whatever you need to go and talk to your representative. So we want to get Chad. Are we done? Are we going back to Chad?
I think we can just go straight into the Q&A. I think that's fine. Chad, do you have any closing words before we go into the Q&A?
I would just say thanks to everybody for being there. And, as you guys have so wonderfully stated today, advocacy is not just going up on the Hill, and it's about getting everybody involved. And so I would just encourage everybody to take that challenge seriously and try to find 5 people when they get home that they can bring into the fold. While we don't have any immediate pressing needs, we do know that for some reason the administration can't keep their hands off of healthcare, and so we will have to continue to fight that fight in bits and pieces. And so the more people we can have, the more powerful our voices will be. So thank you for being here, and let's take some questions.
Yeah, absolutely. Thanks, Chad.
So kind of segueing off of what my dad just said, one of the questions that came in is, if I want to set up an in-district meeting, what's the first step and how can the foundation help? And again, if you just kind of do it on your own, there's a ton of resources online, but specifically, the foundation needs you guys to take that first step and to go schedule the meeting and get in touch with the office. But once you do, there is actually a toolkit that the foundation has already with talking points, with handouts. There's an interactive way you can actually look up which person on the team, and the team is standing back here, from the national office, which one of them you should get in touch with. They can do private coaching things with you guys before you go to your meetings. As long as you guys take that first step and you guys can actually get your foot in the door with these members of Congress or anything like that, there is a lot of resources and personal help they can help you with. I think Zoe has something she wants to say as well.
I do, yeah. Hi, everyone. My name is Zoe Aldrich. I'm one of the advocacy specialists at the foundation. Apologies to folks online. I'm off in the corner. Just to build on what Kevin said, our team is really here to help support you. While we can't always be in the meetings with you guys, and it's about you and your story and you building your relationships with your members of Congress, we're here to provide all the support you guys need. I know we got a question about if we can provide language for how to request that in-district meeting, and the answer is yes, we can. We have toolkits set up for you guys, as Kevin said, that cover everything from how do you find the person to get in contact with to how do you contact them? Is it best to send an email? Is it best to call the office? We have all of that sort of prepped and ready for you guys, so we try to make it as easy as possible because as you've heard from these guys, as you've heard from Jeremy, it's not scary and it's not hard, and we're here to make it as easy for you guys as possible. So we have talking points, we have the script to set up the meeting, we have fancy handouts, all sorts of stuff. And the coaching calls, definitely, I want to give a shout out. You'll talk to either myself or my colleagues, Sydney or Scott here, and we'll walk through everything with you guys to make it as easy and not scary and help you feel as prepared as possible heading into those meetings. So back to you guys.
Awesome.
Oh, great question. The question was, how do we get the toolkit? Come up and see us afterwards, and we'll make sure that we get that in your inbox real quick. Yeah, and your email address, we'll email it out to you. It's a quick, easy little PDF, so come up and talk to us afterwards, and we'll make sure that you get a copy of it if you're interested.
Okay, so a couple more questions. Maybe we can kick this one to Chad. It says, if I'm going to meet with a member of Congress, how early should I tell the foundation?
That's a great question. You can tell them the day you have the meeting scheduled. That way they can make sure that they give you all the materials that you may need, whether it's handouts or one pagers. They'll also, like Zoe was just saying, the toolkit they have, but they'll also provide you with sort of the important facts about how many people in your state have CF, how many are on Medicaid, or Medicare, and sort of what the impact of those dollars is on the care centers in your area. So the minute you have that scheduled, you can fire off a quick email to the foundation and tell them that you have it scheduled, when it is, and who it's with, and then they'll make sure that they have the materials and the resources that you need to make sure that you have a successful meeting.
Yeah, I think we have a question up here. I can just go for it.
This may be a question for you, Chad, but kind of a history question here. About a year and a half ago, there was some publicity that I recall reading about the difference in expected lifespans between CF patients in the United States and Canada. I'm curious, Canada being 10 years longer or something like that. I'm curious where that story generated from. Did it come out of your office, and have there been any interesting policy ramifications as a result of that?
That's actually, I don't know if Mary or Mary's in the audience, or if Zoe's can take it. There is, and I'll let them answer it if they can. That was a study that was done and comparing healthcare and quality in sort of extended years. And you have to take that with a grain of salt because the healthcare system in America is so much more complicated. And in Canada, they have a public healthcare option. They have public healthcare. And so it's very nuanced. And take it with a grain of salt. I don't know if Mary or Zoe are there that can answer it and provide more information. I know that did not come from the foundation. I know that much from that study.
Yeah, I'm going to echo what Chad said. That was not a report that came out of the CF Foundation. But echoing what Chad said, I think it has most importantly highlighted for us the importance of continuous access to the high quality care that people with CF need, which is something that, you all in this room know better than anyone. And it really sort of feeds into the consistent story that we bring to our members of Congress and to our state elected officials, and just helping not only just to answer the question of what is cystic fibrosis, but really try to bring in that education via your personal stories about the importance of access to the care centers, of not needing to miss a medication, or just making sure that we have continuous access to high quality care and treatments, and making sure that we have the adequate, affordable, accessible insurance to ensure that people with CF are as healthy as they can be, and all the benefits that come of that. So it's a good question, but moral of the story is it really just fuels the continuous message that we need to be carrying to all of our elected officials at all level, because just raising the overall awareness helps us achieve our goals and helps them understand why we are asking the policy asks, why we need the things that we tell them that we need.
And if I can just add to that real quick too, if you look at that study deeper, and I just remembered this as I was talking, when you compared like the lifespan from folks in Canada on like their public health care option to those with CF on privatized healthcare, that difference was much smaller. It wasn't a 10-year gap. It was much closer to the same expected life expectancy. Where they get that big bump is because they have so many more people potentially covered, or that have access to that specialized care that Zoe was talking about.
Thanks, Chad. Do we have any other questions from online?
I think there's one that maybe you can answer, because Dad, you just mentioned how you were in Anna Eshu's office 2 days ago. Could you just maybe walk us through the procedure from start to finish of how you set up, scheduled, and then actually executed that meeting, and any resources you used?
Yeah, it was really easy. And like Chad said initially, the resources was email, right? Just, I sent an email, which we do all the time, but sent an email, said, hey, I'm going to be in Palo Alto, and I'd love to stop in the office one of these 2 days this week. And it took about a half day to get a note back, because they get a lot of emails, but I got a note back saying, okay, hey, the best hours and times are this. What's your agenda? What's your topic? And it was a different staffer we didn't know. And so I responded, and we set the meeting up. And I brought in my agenda, and I spent 15 minutes with Ann Ream. But that whole process, on my part, it probably took about 15 minutes. It was really just more scheduling thing. And sometimes it is a week or two out. It just depends. If you ask for a session or time with your congresswoman or congressperson, that's a lot harder. You might get that, and it's great if you do. Please try, without a doubt. You should ask for that. But the next best is either the director or the healthcare staffer. Anyone you talk to in there is a victory, is success. So for me, it was Ann. But one of the things, and I was telling Catherine that when I walked in the office, they said, hey, we were really going to push this out to next week. But then Ann Eshu, we gave her an email. And he said, oh, no. We meet with that family all the time. Meet with Steve. Make sure you spend 15 minutes with them. So it was really nice, because I was really jealous our first couple of years here, because you had the Stroobs and Angie and all these people that are hugging their Congress people, and we didn't know any of ours. And I'm like, what the hell? How come they're hugging them? So I just hug everybody now and just act like I know. But yeah, so I think that's it. It's simply start with an email, and you're off. And once you have that first meeting, and you're doing it twice a year, you become a regular on their show. So
I think also just building on that, 2 points. One of the slides earlier said it's okay to be persistent when you set up your meetings, and that's definitely true. One of our sort of mantras is, be polite, but you can be a little more forceful. These folks get a lot of emails all the time. They're incredibly busy. They're trying to deal with, 30,000 topics at once. So it's very okay to follow up and just say, hey, I'm still really interested in meeting with, the representative or whoever in your office works on healthcare. It's okay to, be sort of the hand continuously knocking on the door, right? And then additionally, I want to just emphasize the power of that personal connection, right? Steve has gotten to the point where there's some name recognition, right? And they know the family and they know the story, and they say, we want to make sure we take that meeting. And you can get there. It might not be immediate, but you keep going back. And once you have that first meeting, you get that person's individual email address, not just the, generic office account. And so you have that contact, and you can say, hey, Anna, I'm free next week. Or I know Jackie has talked a lot about sort of how she sort of continuously updates her members of Congress, sort of in line with their quarterly clinic updates, right? She's like, it's a great reminder to, we go in and then we, get a cool new update about, how Major is doing, or, maybe it's, maybe a not so great update, but it's important to show the roller coaster and all its ups and downs. So it's sort of the continuous touch point, building the relationship, sometimes going in person, but even if you're just sending the message to say, I'm still here, I'm still talking to you, I still need you to pay attention to what my family and I need. And I'm not going away. That's right.
Can I jump in and add something real quick?
Yeah.
I still think it's important to remember that just because you have a meeting and if you walk away feeling like you didn't make an impression or that it was a waste of time, it wasn't. Just because you may meet with somebody who, like everybody said, is dealing with 30,000 different topics, and they may basically just have a head down taking notes and not really feel like they're engaged at all. Your story is powerful and it will leave an impression. So you may not think that they're paying attention, but they do. I tell this story a lot, and I'm sure some of you have probably heard me tell it 3 or 4 times. The first time I did March on the Hill, we met with Senator Warner's legislative, the time she had just taken over as his legislative fellow, or healthcare fellow. And she was new to the position, and she literally sat in our meeting for the 15 minutes we were in there and just took notes. Did not seem very engaged. And I walked out and was like, well, that was sort of a bust, right? We just talked to her and she didn't seem engaged, and who knows how long she's going to be there. We went back 2 months later for Teen Advocacy Day. And when I walked up with a couple of the teens that we were going around with, she knew who I was, knew my name, remembered my story without any prompting. And then I met with her again about 6 months later. And because she remembered who I was, she had actually brought in his legislative director for healthcare. And so, what started out as something that I didn't think we had left an impression with her at all. In fact, we had. So just because you may leave that room feeling like you haven't touched that person and made an impact, you have, and they'll remember who you are. So keep going back.
And off of that, we actually had another question. What if my representatives are already on board with our ask? Which is kind of the opposite of that. If you feel like your meeting was just falling on deaf ears because they already agree with everything you say, it doesn't take away from the impact of the outlook of it. And also, there's always more steps people can take. Just because people are voting in the way we want them to vote on pertinent policy doesn't mean you can't ask them to be a champion for the CF Foundation, or you can't ask them to persuade their peers, and there's more you can always get from them. And even like with Ann Eshoo has always been in our corner on this type of thing. We've never had to go in and convince her of anything. It doesn't take away from the impact that seeing her over and over again and going to her office has had, because, like you said, she now has a personal story of a cystic fibrosis patient in her district that she has actually used to persuade other members of Congress to follow our lead. There is always value in getting our story to as many people as possible, even if they're just going to nod their head and agree with you every step of the way. In some ways, that can be just as or even more valuable than going to someone who can be staunchly on the other side, and we may not actually get the chance to change their mind. So don't be dissuaded just because, and I mean, even for us, most of my meetings I had with offices were with Democratic representatives who were largely in favor of the foundation's policy ask, being from California. It didn't dissuade me. It didn't make it feel any less meaningful. Don't let that scare you away or make it feel like it's not an important meeting to take. There's absolutely a huge amount of value in just getting people to be champions of the CF Foundation and informing them of what our population is going through and what your loved ones are struggling with. So keep that in mind as well. That's certainly important to the foundation and our greater goals.
Question, yeah. Oh, Mike? Yeah.
Yeah.
Okay.
The online people can't hear without the mic.
I don't know how much you guys want to talk policy or anything right now, but I think, and certainly we can talk after, but one of the biggest challenges for people that are thinking about advocating is researching and getting accurate information about what's actually happening policy-wise. So I don't know if you guys just could kind of quick spiel about where we stand right now with the ACA and what's at threat with these upcoming Supreme Court cases and potential policy changes, and to sort of what our message needs to be when we start sending these emails. And again, we can talk after if that's not something.
I mean, normally I'd spend a couple hours on that, Zoe, but
I think that we have a resident expert in the back of the room that can answer that question far better than we can, though. So everyone give a big hand to Mary Dwight on her way up here as well.
I'll be quick. So the best place, because this is a rapidly changing world. I mean, literally this week, we had 2 court cases come down, a decision by the Trump administration to change their approach on how they're handling yet another court case. And there are 3 other letters that just went out today from a large group of coalition of patient advocates. So this is what it's like every week. It's rapid fire all the time on healthcare. The best place to start is cff.org. And our website there has a high-level overview of the policy agenda. And and the news section, we try to keep you up to date on some of the big things. So next week, on Monday, we will be signing on to a friend of the court brief on the Trump administration's decision to not uphold the ACA in court. So you can read a little bit more on cff.org in the news section on advocacy. So it's always changing. It's rapid fire. And that's the best place. Also, we're happy to answer questions. The team, you can always email us. You can always contact the foundation to say, I read about this. I'm worried about that. I heard this piece. How does this affect us? We're here to help you navigate through that. That's our job, is to keep track of everything so that we can help you understand how it might impact the CF community. I'm going to stop there. I'm happy to answer any specific questions you have later, or we can send them in, because there is a lot swirling in healthcare policy these days, both certainly on coverage and access, but also on research. That's actually a bright spot and a good news story. Those are also really important things that we do a lot with. So sign up for alerts and visit the website frequently, and don't ever hesitate to reach out to us at publicpolicy@cff.org. Thanks.
Can I add something to Mary's incredible explanation of all of that? You don't have to be a policy expert to go advocate and share your story. Don't be scared off by the fact that you may not know the ins and outs of the current court case and the current administration's attempt to, completely get rid of the entire ACA, and not just for people with pre-existing conditions. You don't have to know those things to tell your story. Your story is the impactful part of that, and the foundation will provide you with the resources to help you understand what the current asks are, and they will give you they'll give you the huge, detailed analysis of everything in it, but then they'll also give it to you in 1 or 2 sentences so that you can weave those into your story. So don't let that turn people off from joining your team and your efforts just because they may not have an idea about what the current policy positions are of the foundation, or what is behind all of those policies.
I think that's a good way to go into the last question we're going to have, which is, can you share an example of the power of your story and how do our voices matter? It's pretty much exactly what he just said, that the point of advocacy and the point of what we do isn't just to come in as lobbyists and say, here is the detailed policy that we need you to consider. I mean, I was 13 years old when I sat in my first meeting with I didn't know anything about policy. I was there specifically to talk about my brother Owen. And there are professional lobbyists that do that for a living. But what there aren't professional families and people with loved ones that can come in and put a face to this terrible disease. Congressional offices get so many meetings every single day from a lot of really worthy causes. But where we have so much power is in our ability to say, this is a real life experience that's happening to my loved one, and here's a picture of him or her, and this is what it means to his life, and this is what we want, and if this doesn't happen, then we don't know what his life or her life is going to lead to. And there's so much power and emotion behind that it doesn't have to revolve around policy. There's certainly aspects of it that matter, and that's what Mary's team does such a good job of doing, but my job as a young adult now, but in the past a teenager that knew essentially nothing about policy, particularly in the first couple of years, was no less important than the adults that go to March on the Hill or the policy team. There's a reason that we invite a bunch of teenagers to Capitol Hill every year. It's not for their benefit entirely and just because we want it to be fun. It's because it's impactful. And that's kind of where our story and our voices matter. That's why what you guys and your guys' loved ones do matter so much. And that's kind of why me being 21 and just kind of now coming to terms with a little bit of policy, I feel like for the last 8 or so years, I've actually had an impact on the community, even though I didn't know what a bill was or how it was passed, except for that song they teach you in middle school. So that's why our voices matter, and that's exactly what he was saying, is that you don't need to be a policy expert to have a real impact on these legislators.
Just a bill on Capitol Hill, is that what you're talking about?
Yeah.
Okay. Is there one more question?
Yeah, one more.
Okay.
Thanks, Mary. Thanks, Zoe. I'm Chad's dad, and just to reinforce the importance of the personal story, we had the pleasure, Judy and I and Julie, of watching him testify. And if you get a chance, watch it. If you get a chance, read it. But more importantly, you can't see the members, okay? All you get to do is watch Chad. And there were 35 to 40 members of Congress there. And there were 3 other people testifying, and they were policy experts. They were there for a reason. Everybody knew the positions they were going to take, and nobody knew Chad's story. And once Chad started, not a single member, Republican or Democrat, looked at their phones, read a policy paper, talked to their staff. He had their full attention for 5 minutes. And we ran into a couple people on March on the Hill that remembered that. And so, again, your story, you have no idea the power of your story until you start doing this. It resonates and lasts. So I'll just reinforce what everybody has done. If you haven't texted 52886, text it. If you haven't had a meeting, have one. The more you do it, it's like anything else you do in your life, the easier it is. And now it's critical more so than ever.
No, that's awesome. Thank you. That's why that's an amazing story. So listen, guys, we're going to wrap. I think the themes today obviously have been ones we've heard for a while. Until it's done together, that's a big one. Catherine, I'll never forget, and Chad actually makes his recommendation, ask your congressperson, do you know about cystic fibrosis? What do you know? And then it's a really great way to start the meeting. But there's always something in your head that resonates. And for us, it's, we're holding our 8-week-old. And as the doctor came in and talked to us about CF, said, we asked a question, and the answer was, we hope into his 20s. And the question was, it was about lifespan. And we're like, hell no. It's like, Pam today, we're not going to stand for that. But it's only going to happen unless we're together in this with all of the constituencies, all of the help from our congresspeople, all the help from people in this room, it's not going to happen. And it is. I love this morning's session was great. It was such a good session. So have fun for the rest of the day. I think we get a break right now, right, for 20 minutes. Thank you guys for attending, and we'll talk to you all soon.